during the transition, which we've been planning for the last 2 years, there may be some clinic reduction over that 2-week period. However, because of the planning that we've put into that, we will be continuing to have clinical services throughout the move. The move will not happen all in one day. It will happen sequentially over approximately 2 weeks, with different services moving on different days. So if you have an appointment during this time period, you will be informed by letter. You will receive a text message which will also tell you where to attend, and we'll have information in the hospital on the website available to you so that you should know where you're going and where your appointment will be. Hampson House is just for outpatient services only, not for emergency care. If you are concerned, if you have a worry, you need to be seen urgently, then the Rotunda main hospital is where to attend.
Hampson House will be open from early morning to late in the afternoon, but not at night time. So it's very much a day outpatient building and will close at around 7 o'clock every evening.
Hampson House is being basically fitted out as a new building and requires a disability access cert. So it's configured to modern current disability access requirements for both patients and staff, which include lifts throughout the building, disabled access toilets, etc., and various appropriate settings that enable disabled access.
So we don't have parking in Hampson House as it is, but there are car parks nearby. So there's a Q Park just behind Hampson House. Hampson House is just in the Clerys Quarter, so if you're coming into town to go shopping, any of the car parks like Marlborough would be very close to Hampson House. The Lewis line, the Lewis GPO is just at the end of the road. The Marlborough stop is just behind us. So the Lewis runs past Hampson House and there's buses that go up and down all the time. So as a central Dublin location, it's very accessible by public transport. It's very important for us that patients are aware that we're moving, so we really advise to keep an eye on our social media sites because we can update them daily nearly. And every patient who's attending Hampson House will get a letter with the air code and the address and when their appointment is, and we'll do a lot of communication as we're moving. So I think January will be in time when we'll spend the day on the phones making sure women know where they're coming. And once we move to Hampson House, that's where all appointments will be.